How's it? This is Hoala Greavy, founder CEO of Paubox. I'm here in Honolulu, Hawaii with Christeii Gota, and she is the practice administrator for Hawaii Cancer Care. Chris, thanks for being with us today.
You're welcome. Thank you for having me.
Can you tell me more about what the job function is of a practice administrator?
Well, I run a lot of the business aspects of our private oncology practice here in Hawaii, mainly on the island of Oahu.
Can you tell us more about Hawaii Cancer Care?
Hawaii Cancer Care is the premier private oncology practice here on the islands. We have 6 doctors, a hematologist, and oncologists that provide cancer care to patients here in the community.
Now, I understand you have multiple locations, is that correct?
We do. We have 4 clinics on the island of Oahu.
And I also understand you guys have plans for expansion.
We're expanding rapidly. We have infusion centers that we're opening up on the islands, and we are hoping to have satellite offices on neighbor islands as well.
What's an infusion center?
An infusion center is where patients come to get their chemotherapy treatments.
And is it like a mobile lab, or am I totally getting that wrong?
No, we have them here in the clinics, which are usually located very close to the hospital. So our clinic here at Queens Medical Center is in the physician's office building.
And I understand you folks are involved with the community. I think there was a gala you recently were involved with.
Very big supporters of the local communities. We sponsored the American Cancer Society Gala last week, the Hope Gala at the Modern Honolulu. That was a great affair. And this week we are sponsors of the Hugs Gala, which provides support for pediatric cancer patients.
Oh, that's so cool. It's a good business model.
Yeah.
Great business model.
Yeah.
So can you tell us how HIPAA comes into play with the Hawaii Cancer Care?
Yes, we are dealing constantly with health information of our patients, but we work with the community, with different people in the community like radiologists, surgeons at our community hospitals, as well as home care and different services that help our patients during their treatments. And to provide that information, we have to comply with the government's mandate to keep that information private at all times. So the HIPAA compliance is a very important part of the work we do here at the clinic.
And I understand you guys are in a pilot program with Medicaid. Did I get that correct?
Yeah, with Medicare.
Medicare.
We are part of an incentive program called MIPS, which is a merit-based incentive payment system. We will get recognized by the CMS for providing quality care. And one of the aspects, or one of the requirements for providing quality care, is to keep patient information safe and secure.
Got it. Now, can you tell us a little bit more about what life was like at your company prior to Paubox?
Well, before Paubox, we have constant trainings for our staff to keep PHI safe, patient health information. So different things like never mentioning patient's name when you're not in the clinic. Even if you run into someone at the grocery store, you can't say, "Oh, Mrs. So-and-so, it was nice to see you at our clinic today." That would be a HIPAA violation. So we have to remember not to do that. And also making sure that anything that we send over email does not contain the physician or the patient's information. We can communicate with physicians, we can communicate with each other over email, but always using the coded information or the patient's number rather than any of the patient's actual information on email. So it was a very cumbersome way of communicating information.
And as I understand, that can be kind of tricky remembering whose code name is what, then you're on the road.
Right. Yeah, we have several systems, and so we refer to our patients by their medical record number, or MRN. Well, you could give that information to each other over email, but then you also have to be able to access the EMR system to look up the MRN and see what's going on with the patient. And then and only then can you really see what's going on. So it was a little cumbersome. It took a little while to get information back and forth.
Now I understand you folks are using Office 365 for your email hosting solution.
Yes.
And we wrapped around Paubox, around Office 365. Can you tell us what life is like after, now that you have Paubox?
Well, we're still very strict about our security, so we still continue to train our staff to keep PHI safe. But it is so much more convenient to have Paubox automatically encrypt all of our emails. I don't have to worry about, we still use the MRN system, but I don't have to worry if I accidentally mention that, this patient needs this particular test, and is that too much information that I put on email? Or the constant reminders I have to give staff, you weren't supposed supposed to send that information on email. The staff work very hard here, and they're very dedicated, and sometimes, you don't want to make it sound like they did something wrong, because they technically are just doing their job. So Paubox has made it so much easier for us to communicate with each other and resolve our issues that we need to take care of for our patients in a lot faster time frame.
Wonderful. And has the use been increased on mobile phones with Paubox?
We have, obviously, now that we're a very mobile society, a lot of us, especially the executives in the company and the doctors, use their phones to get their emails. So it's been a great blessing to be able to do that, and much more convenient for all involved.
That's awesome. So Paubox is a cloud-based solution. Being in the medical field, that may or may not be the case. What are some of the typical installations you guys go through when you're implementing a new software system? Yeah,
when you guys first came to me about Paubox, I was a little hesitant because we had been looking at different encryption solutions, and they all involved equipment that would need to come into our office and be installed and put in and we don't really have network box or a phone closet that a lot of places have. So I was a little bit hesitant, and then when you explained to me that it was a cloud-based system and there wasn't going to be any actual box installed, I said, oh, I was intrigued by that. And after looking at all of our options, decided that this really made the most sense for us, that it is a box that doesn't have to be a box that's installed in our clinic.
Right.
Very convenient.
And your business is bustling. I mean, you got stuff going on everywhere. You don't need another box in your...
We need every square inch of space in our clinics for our patients and staff.
Right.
Absolutely.
Oh, that's wonderful. Chris, can you share with us some of the cancer innovations that you guys are spearheading?
Well, I am very proud to say that our physicians are the top physicians when it comes to innovation in cancer. You don't get that a lot around the country, but we're very lucky in Hawaii to have 6 very innovative physicians. And in medicine, cancer is the most exciting field when it comes to innovation. There's so much great medical innovation happening that there's so much more hope than there was before with cancer. In knowing what I know in this field and seeing what's on the horizon, it's amazing the things that are happening with technology, biology, DNA, that cancer is really something that we don't need to fear anymore. We've got the tools to take care of it.
So the takeaway is it's the most innovating and exciting piece of medicine in your opinion?
It is. It absolutely is.
I see.
Yeah.
Huh. I didn't know that. Thank you. Okay, we're going to do the lightning round with Chris Gota. Ready?
I think so.
Okay, favorite Hawaiian food?
Lokomoko?
Oh, yeah. That's a good one. What book or books are you reading now?
Oh, gosh. A little bit boring, but they're business books.
Me too.
So, okay. Relative value units for physicians.
Oh, man.
Yeah, that's nothing more boring than that. Yeah.
You lost me a relative. Okay, what's the last Halloween costume you wore?
Oh, I'm very boring. I always wear the same one. It's a witch costume I've had for like 12 years.
Oh, good.
Yeah.
You're getting good ROI on that.
Yeah, I am.
How many times have you seen the movie Big Lebowski?
Oh, gosh. I would say 4 times, maybe?
Yeah, it's pretty good. It gets better after 3, in my opinion. We've seen that movie a bunch.
Yeah, that and Dogma. You got to keep watching Dogma over and over again.
I've only seen that once.
Yeah, because there's so many new things you discover every time you watch it over.
Huh.
Yeah, watch it again.
All right. Theoretical question. In the octagon, who would win, a polar bear or a silverback gorilla?
I don't know exactly what that means, but I would say the silverback gorilla.
Silverback?
Yeah.
Ah, contrarian opinion. Okay, good.
Okay.
It's a raging battle in the office. It's like 50-50.
I see.
Yeah,
okay.
yeah.
All right.
Your favorite karaoke song, your go-to jam?
Sound of Silence.
Sound of Silence?
Yeah.
All right.
Because it's like 3 notes, and you don't have to go up or down too much.
And then last question, you ever been kayak fishing?
Not kayak fishing. I have been in a kayak, but not kayak fishing.
Cool.
50%.
Yeah, 50%. Well, thanks, Chris. Thanks so much. Appreciate it.
You're welcome. Thank you.
Oh, yeah.